Hello, it's Dr. Jo. Risks and benefits of hormone replacement therapy. So the risks and benefits of hormone replacement therapy. There hardly are any, to be frank, nowadays. Breast cancer is the one that I'm always asked about. The background risk of a breast cancer is 4 per 200 women. And some HRTs will increase that risk. It's the type of progestogen in the HRT that increases the risk of breast cancer. Taking estrogen on its own has no increased risk of breast cancer for life, and that is something that we often don't know about. We've got to get that message across. Different progestogens bring with them different risks, and I tend, for obvious reasons, to prescribe those progestogens that are body identical. Another keyword, and we'll talk about that at a later stage. So that decreases the risk. The risk of an ovarian cancer is even less. But let's turn it round and let's look at the risk of having a hip fracture. And by that I mean just a hip fracture. I don't mean the squashing of the vertebrae in osteoporosis of the spine. My mum was 5'3" when she married my father. She died last year. She was 4'8". She lost 8 inches in height. And we'll certainly talk about bones and bone health at a later stage. It will also actively protect you against osteoporosis. It will actively protect you against diabetes, heart disease, certain types of bowel cancer, and there is evidence to suggest it will protect you against dementia. So when you put all that together, that's a really compelling case to be able to take it. But having said that, not everyone does want to take HRT. And it might be because you have a personal risk of a breast cancer. It might be because you've made that decision based on inaccurate information. And my passion is not to make everyone take hormone replacement therapy. To be honest, I don't mind if you don't. But what I do mind about is if you make a decision based on information that is not correct. Because there's lots of things out there that aren't correct. There's also a lot of information about alternative types of therapy for menopausal symptoms. And we'll talk about that another time.